Welcome to HIT Podcast, H.I.T, Human Resources, Insurance, and Technology. I'm your host, Toby Kennedy. As we do every week, I try to keep my ear to the ground and find really interesting players in the space, bring together what I hope are well-curated but digestible, bite-sized sort of conversations. Today's episode is going to be no exception. Today's episode I'm super excited about. We're going to jump right into it. Today's episode is brought to you by Montage Insurance Solutions. And without any further ado, I bring in my guest, Liz. Liz, how are you?
Hey, doing good. How about yourself?
I'm good. I'm good. Thank you. Thank you for being here. Thank you for doing this. And before we go kind of too deep down the rabbit hole, maybe just let me start off with just a quick kind of nickel tour, kind of quick overview. Who's Liz? What gets you in the chair?
Yeah, so I'm the Director of Strategic Accounts and Partnerships here at Tune. I have around a decade of experience in the benefits space. So worked as a consultant on the carrier side, and now I find myself most recently on the vendor side, and I absolutely love it because I'm working somewhere that I'm very passionate about this benefit. So yeah, that's what brings me here today, and I'm really excited to talk to you about it.
I love it. Perfect. We're excited to talk and to listen. And jumping right into it, you're with Tuned, and you talk about sort of this benefit. And what I love is, and so I'll go ahead and shout out Unum. Unum sort of brought you forward and onto my radar as a strategic partner, but I know you guys work more broadly. And so within kind of the benefits world broadly, like what is Tuned? What do you guys do?
Yeah, so Tuned is the first employer-sponsored hearing benefit, and we were founded in 2021, and our goal is to make comprehensive hearing care a standard employee benefit, like dental and vision. So you get your eyes checked every year, you get your teeth checked. We want you to get your hearing checked because that's something that's super important, that's tied to your whole body, and you don't usually think about it. It's something that we take so for granted, but let's say in this conversation right now, the volume was suddenly turned off. We wouldn't have a very productive conversation. So it's super important as far as terms of communication. So we're trying to bring a lot more awareness around hearing health, and we're helping employers feel empowered to offer this to their employees too, because there's a huge gap in care in general for this type of thing.
Yeah, I personally, I feel like my experience with this is I was in like third grade and I had the big bunny ears, right? And they beep, beep, beep. And that's kind of
Yeah.
that.
Yeah, that's actually something I was going to ask you is when's the last time you had your ears checked? I
Yeah.
mean, a lot of people say it's when they were a child. And
Yeah.
for
It was the fine medics at Fern Elementary in Torrance, California.
Yeah, no, I know it's funny, and you're exactly right. It's those headphones, raise your hand if you hear a beep. Obviously a lot has changed since then for all of us. So for me, when I started working at Tuned, I got my hearing exam done also, and it had been, I mean, I don't know how many years.
Yeah.
And it was kind of fascinating to see what was created from the screener that I took. And that's part of the benefit too, is that you get access to this platform that's offered by your employer. It's telehealth, so everything is done virtually. So you never have to leave your house, which is really great. Most counties don't even have a single audiologist, which is why a lot of people don't even get this done. And a lot of people put it off too. It's kind of hard to admit that you have a hearing problem. Most employees aren't going to tell their employer they can't hear the meetings. So we really try to make it super easy for people to access. So
You have to do outreaches to spouses, right? Because then the wives are gonna be like, he doesn't listen. This son of a gun's
yeah,
been going deaf for years.
you say here, actually, I hear fine.
Yeah. Yeah, no, he just
Yeah,
doesn't want to listen. That's right. Yeah,
right.
exactly. So you can't do anything about selective not hearing, but
Right. You can
actual
help
hearing loss.
with hearing
Yeah, I think
loss.
this is such a fun and creative benefit because, as you mentioned, at its core, and any jokes aside, obviously we're trying to have a jovial conversation, but more seriously, that this is an actual health matter, and it really does tie to overall health in ways, as you mentioned. Number one, people maybe don't want to always admit it immediately because perhaps it's tied to signs of aging that everyone's kind of trying to slow down. But number two, it might not just be that. It might not just be, the more senior employee that's losing their hearing for the arc of natural aging. There's lots of things that go into this, and there's lots of reasons why it's important. So maybe I'll kind of let you give us the sort of, hey, all jokes aside, hearing health matters because.
Yeah, so that's a good point. And it's not just severe cases that we manage, like those traditional discount hearing aid programs, which are just that. It's just a discount on a pair of hearing aids. We cover the entire continuum of hearing health. So we say from prevention to intervention. So prevention is, for people who have no hearing issues, but you are probably on headphones most of the day, especially if you work from home, if you're a concert goer, those are just standard cases, but there's a lot you can do to protect your ears early on before you have permanent hearing loss. And the World Health Organization actually did a study recently. Over 1 billion people between the ages of 12 and 35 are at risk for permanent avoidable noise-induced hearing loss. And I say avoidable because there's a lot of steps you can take to prevent yourself from having hearing loss. And it's called hearing loss for a reason. Once it's gone, it's gone. If you lose your vision a little bit, if you can't read words, you can put on a pair of glasses, but with your ears, it's, you kind of, once you lose it, you can't get it back. We can help you amplify it. We can help, there's these behavioral apps that are out there to help you with different types of symptoms, let's say for auditory processing disorder. But again, once it's gone, it's gone. And it's not trying to scare anyone, but
Right.
want people to be, more aware of it and be a bit more mindful too when they just do everyday tasks.
Well, and because as you mentioned, A, once it's gone, and B, sections of this are preventable. So no, it's not about fear mongering or anything. It's about an education campaign to say, hey guys, this is a spectrum. We can intervene at different places that might have a quality of life impact for you.
Absolutely. And another thing too that we can even treat is tinnitus, and that's the ringing of the ears. So you can't
Yes.
cure that, but there's a lot of treatments that are available that can help, behaviorally. So that gives people much better quality of life because a lot of people don't realize how debilitating tinnitus can be. I mean, it causes pretty severe depression, and for the most part, you don't really have any sort of option to take care of it. Again, you can go to an audiologist, but there's not a ton out there. And for us, if got the tune benefit, the audiologist determined that you do in fact have tinnitus, which I'm sure you would know.
Mhm.
There's a variety of treatments they can do, and we have specialists they get referred to. So it's really neat that we're, on the cutting edge of trying to treat this very under talked about, underdiagnosed condition.
Yeah, I don't quote me on this, but from some of my friends and folk that served, I think it's one of like the
Mhm.
biggest veteran issues out there, and it's really under talked about, as you mentioned.
Yeah, our co-founder and CEO Danny, he's a veteran and has moderate hearing loss too. So it's one of the reasons why he created the company, because the process to get treatment for that is so terrible,
Yeah.
for most people. It's really hard to actually get treatment for this.
So let's get out in front of someone who's being really quick. We're all busy. I just looked at this. I heard hearing something. I assume it's, I don't know what, you provide me a hearing aid, right? So maybe tell me kind of a little bit more. If we bring tune to the table, and we've touched on some of it, so I don't want to discount that, but really just kind of hit this one straight on.
Yeah, so for employers, it's solving a gap in care. You get a hearing health benefit, so that's access for every single member. You have access to the telehealth platform. You take a screener. You get 3 consultations per year with an audiologist. And then if they determine that you do need a hearing device, like an OTC device or a hearing aid, we send that to you to your house, and it's covered at 100%. So there's no co-pays and no additional fees. And this is because it's an employer-sponsored program. So for a really low PEPM cost, that's under $2 per employee per month. That's very, very low compared to other benefits. It's a super rich benefit since the device is covered. Usually you still have to pay a pretty large sum of money out of pocket, especially with the discount programs. Maybe you'll get 1,000 off of a pair of $5,000 hearing aids. So for Tuned, it's helping people get access to something that they normally wouldn't have. They're not putting off, taking care of their ears. They're actually getting assistance for it. And then they're getting a device if they need it. So I think that's really kind of powerful for people who
Mhm.
have access to this. And then one of the number one things we recommend for people who don't necessarily have severe hearing loss is earplugs.
Mhm.
And it's not just those foam ones, those kind of terrible ones they give you on the plane that are
Mhm.
super uncomfortable. There's these
Mhm.
high fidelity earplugs that you can wear to concerts and still get a great experience with the music, but still have this really great protection for your ears.
Yeah, you're talking about protection and this being an employer benefit. And I just wonder, do you see, so we mentioned, concerts and things that people do as a hobby, or obviously some people set up concerts for a living, but I'm thinking more maybe like the machine shop guy or someone that's working with types of equipment that is
Sure.
creating some sort of hearing damage. Are you seeing employers coming at this from almost a workers' comp prevention standpoint too?
Yeah, absolutely. So that's another facet of the program also. So we have the benefit side, and that's, the 3 visits, the platform. We also have for hearing conservation program. So that's our STAR benefit. So that's scheduling, testing, analytics, and recording. And that's a whole different thing. So that's for people who are exposed to really loud noises working in machinery, manufacturing, that should be wearing hearing protection. And we help automate that process. So all the scheduling is done online, all the testing is done in person, but not in a van. We have these really sophisticated products that we can use and send on site for people to take a hearing screening just in a quiet room. So no more of those vans and having to coordinate that, which is just a huge, burden for companies to try to manage. And then, scheduling and recording everything, it's all in one place. So it's not with different, consultants that you'd work with. It's not with different vendors. It's all combined in this one really easy to use platform. So we see a lot of companies take it from that angle too. And
Yeah.
then they like to couple it with the benefit also, because then once you determine, hey, yeah, these people are probably going to have some hearing loss, what can they do now? And maybe a lot of people weren't wearing their earplugs properly, or just a variety of things they could do. So it's kind of these two angles you can come at with and help people who work in loud environments and help people who work not in necessarily loud environments, but want to have a better quality of life in general.
Yeah, I like that. And I do appreciate bringing it back to the benefits because that was going to be my next question. And it's maybe just a little like nuts and boltsy sort of a thing. But you mentioned a PEPM or a PEPM or a per employee per month. And that is the manner in which you guys obviously fund your program. Do you typically, first of all, you said it's around slash under about $2 per employee per month. When you say that, do you mean per employee or per belly button? So if I've got, can I extend this to spouses and children?
Yeah, absolutely. So it's per belly button. So that's the great thing too, is you can offer it to your spouses, your dependents, children down to age 13. And then next year will be down to age 5. And pediatric audiology is also really difficult to access too. So I think it's really amazing that kids can have this benefit also, and then learn early on how to protect their ears, because we call the kids the headphone generation because it's just that. They're on their headphones all day long,
Yeah.
gaming. They have iPhones
And
now.
I've got a 5-year-old and 8-year-old, and God forbid they set the volume appropriately ever. Those things are cranked up to 11 for these poor little guys.
Yeah, no, I know, and it's hard to know really how long you should be listening to noise too when you're younger. And
Yeah.
so just giving your ears a break throughout the day is really crucial for that sensory cell turnover for your ears, to function properly.
Yes, thank you. Okay, so you mentioned that, I almost heard you say the word could when you're talking about spouses and children as if that might be optional.
Mhm.
And then you mentioned employer funding of this. So let me maybe get into, from the funding standpoint, do you see employers typically funding, always funding? Maybe they fund the employee only portion and the employees can add their dependents on a voluntary basis. How do you see this from an employer cutting the check
Mhm.
versus employee deductions with respect to both the members and their families?
Yeah, so this does have to be 100% employer sponsored. It's not a
Okay.
voluntary benefit.
Yep.
That's the way we're able to keep the costs so low.
Mhm.
Not a huge percentage of people actually do need those hearing aids. For the most part, it's people with mild to moderate cases. So the way we can keep costs low is offering it to the entire population.
Mhm.
And they can decide to just extend to employees or employees and their dependents. We see about a 60-40 split. And then there's cases where
60-40 in what direction? I'm sorry.
yeah, so
60% offer employee only?
60% employee only, yeah, and then 40% with dependents. And sometimes clients will decide that they want to add dependents mid-year because the employees are talking about it, their spouse hears about it, and they really want to have access to it too. So it's pretty flexible from that standpoint.
Yeah, I love that. You mentioned that, one of the ways you keep your costs down is by being employer funded. And for anyone listening at home, what I hear as an insurance guy is, hey, adverse selection, participation requirements. We don't want just the few that would have need a hearing aid because at $2 per month, we're not going to make enough, et cetera, et cetera. And what that triggers me to think is about any version of underwriting or pricing changes. Do you guys request any data on the front end to formalize your quotes, or is it just employer size?
It's just employer size, and it's the same cost for any group size. So 100 up to several thousand, it's one low PEPM.
That's really great. That's really helpful. And then, as you said, they can sort of add dependents throughout the year. Is there anything surrounding plan year or utilization or kind of, I'm thinking open enrollment, but obviously this is 100% employer paid and therefore 100% participation, but anything with like a frequency or something that we'd want to touch on as far as the benefits?
Yeah, so those 3 consultations, that resets every year. So it's kind of like with a vision plan, you get your annual vision exam once a year. For dental, you get your annual dental exam. It's the same type of logic for that.
Because when you say there's 3 auditory consultations, and you say per year, is that within a calendar year? Is that within a plan year? And the reason I ask is, let's say I'm a new hire and I join the plan partway through the calendar year. Are you guys looking at a full, like an actual 365-day window, or talk to me about that?
So yeah, it's plan year. This doesn't have to be offered at the same effective date as the other plans that a company might have in place. We actually find it's better if they offer it mid-year because it gets a little bit more engagement. Because
Yeah.
open enrollment, it can get a lot can get lost in the sauce because there's a lot of new things being offered and people are mainly focused on
Medical,
medical.
payroll deductions, the new HCM, the new blah, blah,
Exactly.
blah. Yep.
Yeah, so we want people to take advantage of the benefit. So yeah, mid-year plans are great because it's just people are more, they're just looking at it a bit more.
So you're talking about mid-year plans, and therefore we're talking about plan years,
Mhm.
and that gets me into thinking like contract years and contract length. So when you say right now we've got this low PEPM, here's what we're charging, you tell employers that that's good for the rest of the plan year, and we evaluate this every year at renewal. It's a 2-year thing, it's a 5-year thing. How long if I know, all right, I'm going to budget for this cost, but I don't want everyone to fall in love with Tuned and they give me a 100% increase in 2 years or something.
Yeah, so they're 24-month contracts.
Okay,
They get
great.
2 years, and we're really focused on keeping the cost very low. So for renewals, we're being very mindful of the market, and that
Yeah.
comes up with ample notice too. But we haven't had a client term yet mid-year
Yeah.
or term a contract, so I think that's great. And we're still a newer company, but we have really high customer satisfaction because this is so different from anything else on the market.
Yeah, I agree. So how about starting this contract? Is there initiation fees? What does it look like if I'm an employer and I want to roll this out? What's the workload? Talk me through some of the onboarding.
Yeah, so that's the best part about it. It's a really low lift for admin teams. So it's one contract that's signed, and then for implementation, there's an account manager that's assigned, and they walk through that. And we have a platform we use called Hint, which we manage enrollment and billing on. And then you can choose to set up a file feed, no additional cost. We work well with all the major HRIS systems. So they can choose to do file feeds if they want to. People will do it manually sometimes. You can send it a census file, but initially we do a census file with just very basic information, first name, last name, date of birth, employee ID, SSNs are not needed. And then it's pretty simple to manage. Our account management team takes over, and any sort of troubleshooting that comes up, we have a lot of support, and we do custom communications if groups want to do that. We can push out communications, which we find to be really useful in getting utilization up. So it's whatever the employer really wants, and there's no initiation fees. One of the best things too that I don't think I mentioned yet is that employers can use wellness funds to pay for the Tune benefit. And I know that that's an option for a lot of companies.
Yeah, I don't recall that you mentioned that. And that's a great note. So thank you for mentioning that. So how about from the member experience standpoint, right? So if I'm HR, I'm thinking that's great. They get these 3 visits, but if they forget or they want to call in, they want to figure out who to go to, where to go to. Do you guys, staff up and equip the HR team with a member-facing customer service department?
Yes, we have a customer care team. There's the chat function, there's a phone number, so there's plenty of support for members if they have any sort of issues that come up. But it's a pretty easy to use platform. I think it's very user friendly. The screening that you actually take that takes 10 to 15 minutes is interactive, so people don't really feel like it's something that's hard to do. And you can do it with whatever you have, so a phone, laptop, just whatever headphones. So we make it super simple for members to get access to it and use it.
This is super cool and super straightforward, but yet super needed, right? Like it's one of those things that this is exactly why I kind of try to do this sort of a podcast is, there's always, as vendors popping up in the space and lots of people trying to solve for problems. And I find the solutions to be of varying degrees of efficacy and frankly, the problem to be of varying degrees of invented. But this is a really nice solution for a real nice actual problem.
Yeah, it's just something that's really underaddressed. And, there's a ton of point solutions out there. I know you're familiar with that, and people get point solution overload sometimes, especially employers. It's like, really, there's something else. But we're not really a point solution since we're taking this preventative care aspect. So we're really trying to get people to think of it as whole head health, we like to call it. So your eyes, your teeth, and your ears, you're getting everything checked out. And there's just so much just attached to your ears that you don't think about. Just getting a baseline hearing test, if there's a certain audiogram pattern, they can actually tell that you're at risk for a cardiovascular disease. And that's really important to catch those before they become something bigger. So a lot is tied to your ears. And we want people to just get that baseline hearing test to make sure they're tracking for changes, kind of like you would for an annual physical.
Yeah, yeah. No, I appreciate the heck out of your time. Is there anything before we get out of here that's left that I'm driving a lot of this by just asking what's on the top of my mind, but anything I didn't think to ask or know to ask that you'd like to touch on?
I think we covered the large part of it. It's just
Okay.
mainly getting the word out there for this for employers. Not just another point solution, but a preventative care approach
Yeah,
for hearing care. And yeah, I think that covers everything.
I totally agree. And thank you so much for being on, Liz.
Yeah, no, thank you for having me. I really appreciate it.
Awesome. Well, that's all the time we have for this week's episode. Thank you guys so much for joining us. Thank you to our sponsors, TrueHue. And join us next week. Join us every week. We're having great conversations. We're really enjoying what we're doing. The numbers are going up and up. So thank you guys for liking and subscribing. We'll see you next week. And until next week, make this the best week yet.